percentage, okay, not BMI, but body fat percentage, is a woman who has greater than 38% body fat is considered obese. Okay, so guys, there's a lot of people out there right now that have greater than 38%, a lot of women that have greater than 38% body fat. For men, it would be greater than 25% body fat. A lot of men out there that are greater than 25%. So remember, a couple of weeks ago, we talked about that 68% of people, okay, today, 68% of people are either overweight or obese. Okay, so would you say that we have a real problem with people being overweight and obese? Yes, okay, if 68%, that's a very high number. We're talking about getting very close to the 70, and pretty soon it's going to be 75%. So it's like we've got to do something, and so there's a lot of people out there, guys, for you to work with, all right? So when we're talking about causes of obesity, it's a lot more complex than just the consuming excess calories, okay? So there's a lot of things that we need to consider, and you can see this information on page 378 in your text and in your workbook. But basically, there are a lot of biological and psychological factors that contribute to obesity, and a lot of challenges that result when a person tries to lose weight. All right, so there's definitely an imbalance between the energy intake, so the amount of food that we're taking in, and the energy expenditure, so the amount of calories that we're burning. So people that are accumulating too much body fat are taking in too many calories, not expending enough. All right, so typically it's due to lifestyle. You hear a lot of people say that it's genetic, oh, it's in my genes, everybody in my family is overweight, and so forth. And there is a little bit of evidence out there that shows some genetic disposition towards obesity, but guys, the main culprit is lifestyle, okay? So you gotta, get that through to maybe your client or whatever in a nice way, and letting them know it's like, hey, I realize everyone else in your family is overweight or so forth and all that, but let's work on some changes for you, okay, and figure out how that we can get your body fat down. So the prevalence of obesity is definitely rising in the United States, and the real issue is that the rates are drastically rising among children as well. Okay, so that's a real issue. You can see here, look at this timetable. You can see that the prevalence of abdominal obesity, and so this is, abdominal is where men carry most of the body fat, and the abdominal and the hip region is where the women carry most body fat, okay? So the android pattern is the male pattern, chest and abdominal, and then the gynoid pattern is that abdominal and hip region. So you can see how the prevalence is increasing among men, even greater in the abdominal region than women, but it's continuing to incline over the years. So there's a lot of health consequences that are related to obesity, and I think that we probably all are at least familiar with most of these. We've talked about a lot of this already. Increase in mortality and more rate of death. I mean, likelihood that we're going to die sooner at a younger age is greater for someone who's obese for a lot of reasons. More stress on the body, more stress on the heart mainly. So a lot of coronary heart disease and congestive heart failures are all due to the onset of obesity starts to cause heart problems. The heart is trying to work really, really hard to support the body weight. So that's a real issue, and because of the way that we're eating, we might develop a lot of heart diseases, okay? We might develop type 2 diabetes. That's a real issue, right? So type 2 is the one that's lifestyle oriented, right? Not the type 1, which is juvenile onset. And then obesity is also linked with high blood pressure, dyslipidemia, so the blood lipid profile of the cholesterol, triglycerides, all that's high, gallbladder disease, osteoarthritis. We just were talking about arthritis earlier and how, you know, a lot of people who are overweight start having a lot of joint problems, right? Because we got all that extra stress and that extra weight that we're carrying around. If you are, this is an interesting thing to do. Like I've known someone who, let's say they've lost 20 pounds. Okay, so they've lost 20 pounds, you know, super exciting. All right, then what you do is you hand them a 20-pound dumbbell, okay, and you let them know what it feels like, and this is what you were carrying around. You know, this is what you were carrying around. Even an extra 5 pounds, an extra 10 pounds. Think about an extra 50 pounds. I mean, if I had to bend over right now and pick up a 50-pound dumbbell and carry that, I mean, imagine the stress on my joints, okay, on my spine, my knees, feet, and so forth. And, guys, carrying that extra weight is a lot of stress on the heart, okay? So that's the issue. And then obesity is linked with cancer, and then definitely, or some cancers, and then definitely sleep apnea and respiratory problems, okay? So do you know anyone who has to use a breathing mask? You know, maybe at night when they're sleeping, because they actually fall into that sleep apnea where they're kind of stop breathing, and maybe wakes them up or maybe doesn't. Has anybody ever met someone that has sleep apnea? No?
Yes.
Okay.